Catheter kinks and occlusions can occur both at the spinal anchoring site and in the pump pocket. At the spinal anchoring site, body movements may cause a catheter to twist or kink if there is insufficient or excessive slack in the system. Kinks can also occur if the catheter and anchor are sharply angled, either due to improper anchor orientation or changes in catheter and anchor position when the incision is closed. Performing the implant procedure through an incision that is too small can also lead to these complications. An incision at least 5 centimeters long is usually required to accommodate the anchoring hardware. Once the incision is made, it is important to undermine the edges to develop a smooth fascial plane for the anchoring hardware and to permit gentle bends in the catheter. This procedure also allows the anchor and catheter to remain properly positioned when the incision is closed. Both a primary and secondary anchor should be used, with sufficient slack between them to allow for patient movement without increasing tension in the system. Sutures should never be placed directly around the catheter tubing to anchor it. These sutures may kink or occlude the catheter. Kinks can occur within the pump pocket if there is insufficient catheter slack or if the pump is oriented improperly. Either of these situations can subject the catheter to increased tension from body movement, particularly at the pump connection site. Excessive pump movement within the pocket can also kink the catheter, especially if the pump flips over or spins on its axis. To minimize kinks at the pump pocket site, coil at least one loop of catheter behind the pump. The system should be arranged so that no sharp bends are present for the entire length of the catheter from the pump connector port to the spinal anchoring site. To avoid excessive pump movement, be certain to suture the pump to the fascia within the pocket in at least 3 places around the pump circumference. Incorporating these surgical techniques can reduce catheter kinks and occlusions, both at the spinal anchoring site and at the pump pocket.